Good morning, everyone, and happy pre-Friday. It's Thursday again, last Thursday of the month. Just want to give a few more people an opportunity to sign on, and then we're going to get started.
Perfect. So they did get it.
All right, good morning. Let's go ahead and get started. We can move to the next slide. So good morning, everyone. Glad you're able to be with us on this Thursday. We've had some great weather, and then we have what is probably closer to Chicago weather out there this morning. So I'm hoping everybody made safe travels in and will be able to make safe travels home at the end of the day when we'll see snow on the ground. But I wanted to go ahead and get started with a couple of updates from myself. And then, as always, I'm going to turn it over to my team. I will still be monitoring the chat box to see if there are any more questions, just in case I miss anything as we go through this. And so the first thing on the agenda is to just let everyone know we did have our FA1 this last week. It started on the 6th of February. An FA1 is where you are able to, as a funded entity, describe all of your systems and how you operate your programs. We, DFSS, are a little bit different than most recipients in that we don't directly operate any programs. And as a result of not operating any programs, directly operating any programs, our systems are a little bit different than a lot of organizations. And so it's always, something to try to describe exactly how everything starts here and ends there where all of you are. But we believe we did a pretty good job of explaining our systems. An FA1 is a precursor for an FA2, meaning that they will look at all of what we've described in our systems. And when they do the FA2, they'll be coming in looking for documentation, data, et cetera, to document exactly how we say we did what we did. And so we have completed the FA1. We'll be expecting a response from that in about 45 days or so from the week of the 6th. And again, we're still in a program year where we could still get an FA2 because the program year does not end until June. And so we still have an opportunity to have an FA2 this year. And one of the things I want to remind everyone is that we are year round, and there's not so far-fetched that they could do an FA2 in the summer months because we do operate 12 months out of a year. Both our Head Start is full day, full year, and so is our Early Head Start funded programs as well. And so that's also a possibility. So again, just keeping FA2 on your minds, but just wanting to make sure that you understand we did complete our FA1 the first week of February. Want to give you an update on the application. Our application normally launches in April. We did have one time where we pushed it back a little bit, but it is scheduled to launch April 19th of 2023. It will come out again as we did this last time when we updated the system, where a parent could go on and find your programs 0 to 3 and 3 to 5. They could also find services for home visiting and doula, all in that one application. And so we're updating it again. I know there will be some verification, making sure that we have all the right information on your organizations before we launch it to make sure we're not missing anything. But the application itself is due to launch April 19, 2023. And then after, of course, after it's open for a few weeks, then what we will be doing is giving offer letters. And so as we go over the next few months, we'll talk more about application. We'll be talking more about offers, and we'll be making sure that everybody understands what our expectations are of you and working in that application process over the next few months. One other thing I wanted to bring to your attention is we are in the process of writing our support services RFPs. We did get a year extension, but now this year, 2023, it is due for us to put all our support services RFPs back out there. Our support services RFPs, for example, for health, mental health, dental, nutrition. We have one for program design and management. There's multiples that are going to come out, but all of those are due to be launched by summer. And I say by summer because we're going to have schedule where a few will come out, and directly after those, a few more, because there are quite a few of them that we're trying to get out on the ground. And so those will be coming out. And as always, any RFP that's put out through DFSS, you can always find it on the City of Chicago website. And that's where all of our RFPs are launched from. That information is there for anybody who's interested in applying for any of those RFPs. CARES update, and I do see a couple of things coming in the chat, so I'm going to revert back to that in just a second. CARES update, as you know, we are still updating the system, still working on the system. It is not complete, but we need everybody, 100% of you in the system. And so I'm going back through and I'm determining who is not actively using CARES. And we'll be talking with you because, again, it is our system of record. And if everything's not in CARES, and when we're trying to get information out of the system, we're not getting everything we need. Hence, coming to you, asking for information on enrollment, attendance, and meals, because we can't get a collective report out of the system because everybody's not in there. And so we're going to continue to have to do workarounds until we can get everybody in the system using all of what's in there and all of the screens. And so, again, we're going to continue to work with you. I know that there's been some, fits and starts along the way with the system, but it is our system of record, and we do need everyone participating in that system. I'm going to look at the chat really quickly before I go to the next two. Will families only be able to apply for the new program year 2023-24, or will they still be able to apply? There will be a period of time where we will be shutting it down, and everybody will know that, but parents will be able to apply for both because we do year-round programming. And so, as I said, as we get further down the road, I'll be giving you more dates so that you understand what's going on, when they're going to have to turn the system off so that they can actually turn it on for 2020, 23, 24. So there is a little glitch or a period of time when we have to do that, but we'll let you know that. I'm just giving you the date of when we're talking about launching. We're going to keep you involved and up to date on where we are in the process so that we can make sure that you know what date, for example, is not going to be accessible for this current year, but there will be access directly after we are able to open up the 2023-24 year. When we'll be able to input case notes, one second. When we'll be able to input case notes for attendance and any other communication with families. I'm working with the vendor now to verify what everything is that you can do in that system. I'm now meeting with them several times a week because we're trying to bring this thing home. And so I'm going to give you more information. And so for me, if you are not able to input something that you're trying to put in there, because some people are getting things in and others aren't, I want to make sure that I understand some of the why behind it. And so if you can send me an email so that I know exactly what you're able to do and not do, so that I can make sure that I can look at the what the accessibility is on your side of this. So it may be eliminating some of the things that you're able to do. And that's what we need to continue to work on, is making sure people have the right access so you can do all of the things you need to do in the system. So I'm going to go ahead and let Mara pause the screen for just a second, and then I'm going to come right back to you. All right, so when I speak about Salesforce, can you ask them to activate the reporting function? That's one of the things that I'm working on right now, is on reporting. Amina, thanks for putting that out there. That is one of the pieces that I'm trying to make sure that we get done fully, so all of you are able to do all of what you need to do within the system. So we're working on all of that right now. It's not active to you. It will be at some point. If not directly on one screen, we're going to make sure you have the screen access that you'll be able to do what you need to do. So I'm working with the vendor on a few things that we find are going to be a little bit more cumbersome, trying to go directly into the Salesforce or CARE system. And so we're coming up with other ways to make sure you're able to effectively do what you need to do on your side of the house. So more to come on that. Thanks for the question, Amina. So another update for you, SNAP. I've talked about it before, SNAP being a categorical eligibility for Head Start, Early Head Start, and other federal programs, other federally funded programs. One of the things I want to remind you that you need to do on your side, you have your eligibility, and what you're saying makes a family eligible on your side. We do it on our side. I need you to update and seek approval from your board and policy. Anytime you're adding something new to that changes what the points are, how a family is determined eligible within a Head Start or early Head Start program. Anytime you add or delete anything, you need to go back to your board and policy. So as a reminder, go back to your board and policy, adding the word SNAP, what it is, so that they understand exactly what it is. It is categorically eligible, and making sure that you've done it on your side of the house as well. We're doing it on our side. Need you to do it on your side as well. January 2023, there's a new federal poverty guideline that's out there. The link on here is an active link. So when you get this, you'll be able to go directly to it if you have not already. And so we did get a new federal poverty guideline. It is another small bump or an increase. And so we are making sure that you understand what that is. And yes, we'll put the link in the chat so that you have that as well. Yes, we'll do that. Thank you. But what we want to do is make sure that you understand that there is a new poverty guideline, keeping up with it, making sure that you're adjusting things in your house as we're adjusting things on our side as well. I'm going to stop there and see if there are any other questions, because the next few slides that I have is going to take me a little bit of time to get through. Doesn't look like I've missed anything. I'll keep on going. The next one is on incidents and incident reporting. So next slide, please. We are having a few technical difficulties on our side, so please bear with us as we go through these slides today. One of the things I want to remind everybody about the importance and the requirement for reporting. One of the things, and this is a link, and we can put this in the chat as well. One of the things I need everybody to understand is that you are required to report incidents to DFSS. You're funded through DFSS, and this is regardless whether you're federally funded or state funded. If something happens on your side, you are required to report it to us. I sent out a memo back in 20, and what that memo talked about is active reporting and what the requirements are. We're going to send that back out again, making sure that everybody has it in their hands, making sure that you don't forget what it says, that you don't forget what it is that we're asking you to do. I'm going to go through this, and then I'm going to come back and explain to you the why. In our Chicago Early Learning Standards Manual, which we did update, it says immediate same day So if something happens today, February 16th, 2023, you are required to let us know on February 16th, 2023, that something happened at your agency on that day. What we do understand is you're just giving us notification that it happened. You are required to give it to us the same day. We've given Office of Head Start our policy and our procedure, which states immediate same day. So their expectation, if we're having to report anything to Office of Head Start, is that we're able to say it happened on the 16th and it was reported to us on the 16th, either via email or a phone call. But you are required to do that so that we can document that you are following our policy and our procedures, which mimic what's being required at the federal level. And so I can't continue to have incidents that occur where I find out about it a week later, because then again, you've not operated within our policy and our guideline. And then if you take a week to get to me, that also means that I'm behind in reporting it to our federal funder. We can now no longer continue to do that. I need everybody to understand what we mean by same day. Again, if something happened today on the 16th, I'm expecting that somebody from your organization is going to reach out to our team lead, either Jacinta or Nicole. You're going to CC Elaine Millsap Parker, who is a supervisor. You're going to make sure that we know something occurred at your center or your facility so that we can then document that into our record. So then we're looking for a written report from you. The incident report should come in within 24 hours. And so you report it, you just give us the heads up, this happened. We document the day and the time that came in. The staff will be immediately documenting, we received it on this day and we received it on that time. That then goes into our report to Office of Head Start. If it's reportable to Office of Head Start, what we're saying to them is, we got the report on that day. Here's the day and time that we were actually acknowledged that this occurred at this particular site. These are must-dos. These are not optional. I do understand that you all have guidelines and things that you do within your house anytime something occurs. I'm not trying to negate any of that. What I want to do is emphasize the importance, urgency, and requirement that you immediately report it to my team here, either me or someone. It is not going to be something that we're able to continue to do where we're not getting them the same day, because it pushes back our ability to actually follow through on our requirement with the Office of Head Start. And that's a problem, and we can't continue to do that. The steps that we want you to follow, again, same day of incident, is reported to DFSS. Report, follow up with a written report within 24 hours, and then we will be following up with you, requesting any additional information or whatever else we need. If we're having to do a full investigation, this will start that process. If you're doing an investigation on your side, it will start that process as well. But immediate same day. Is there any question from anybody who's hearing my voice this morning who does not understand what I mean by immediate same day? So I do have a question in the chat box. Verify the process for home visiting programs. In home visiting programs, it may be a couple of days or even a week or two before we know about an incident with our families' kids, since we don't see them every day. When you hear about something that happens, for example, if something happens to a child in a home that you're visiting while you're not there, then that, as soon as that report comes to you, is same day to us. You're saying this again, that this is when you're notified. One of the things that I ask you to do within your home visiting programs is, even though you're not there in the home, that you're working with your families and expressing the importance of safety for all of our children. So if something happens to a child, even though it may not be the date of your home visit, they're still reporting it to you and letting you know that an accident or incident happened so that you're aware of it. Then it's in your records and then it's in our records. But when we're doing something offline, for example, if it takes a week for them to get it to you, then it takes another week for you to get it to me. We're almost 2 weeks, 2.5 weeks before we say to Office of Head Start, something that may be critical has happened with one of our children, and we can't do that. We have an onus and responsibility to report as soon as we know. And so as soon as you know, you must report home visiting as soon as you know. But the question that I would have for all of you, even if you're not home visiting that day, you should have a communication ability with your families where they know if something happens in their house or their home with a child who's in your program, that they're reporting that to you. It may impact your ability to visit that child the following day. That child may be sick or ill. So you won't know that if there's not this communication chain or thread between you and your parents. And so I'm going to ask you to work with your families to make sure that they're communicating with you anytime anything happens. Therefore, you're still able to report to DFSS. So I see one from you, Will. Is it a policy for all incidents? I'm going back to where I was before. And where I was before is where I said all incidents. I'm going back there and I'm going to explain to you why I'm doing this right now, Will, and why I'm saying all incidents. Until I can get us back on track where I'm getting everything, I need to get everything. I would love to specify and say only these or only these others. I am in no way in a position to do that because some people have not reported same day. I need everything to come through. My team and I will discern through them and we'll put them in the correct category. We will, I hope, at some point get to a point where you don't have to tell me about the small scrapes and you don't have to tell me about the child who fell on the playground and had to get a Band-Aid. But until I'm getting everybody reporting everything the way that we need to, I'm going back to how I started this. When we did this at first and I initiated Tell Me Everything, I'm back at Tell Me Everything so we don't miss anything. And again, I'm hoping that we will get to a point where I don't have to do that, but it's the policy right now. And that's why I'm speaking to you this morning. And I know my poor staff on the other side of this, hearing my voice again, are going, oh my goodness. But until we can get everything in and we're not worried about what we're missing, I'm going to be asking that you tell us everything. Trying to scroll down, I see there's a couple more. Just know that for home visiting, unlikely it will be the exact same day of the every. And so that's, again, we're going to work with the home visiting programs to talk a little bit more about some of the issues. But again, I'm just asking that we do everything that we can to make sure that we're getting it to us as soon as practical. I just have to say that because, again, I remind everyone, we have the responsibility for approximately 15,000 children here at DFSS every day. I listen to the news, and every time I listen to the news and there's a child 0 to 5, I have to think about whether or not it could be one of our children in our program. And then did I get the report about something that happened to one of the children in our program? And so I know that you also need to understand that Office of Head Start Region 5 is in the city of Chicago, and they're listening to this as well. And so, of course, they're hearing about incidents. They're waiting to see if it's one of ours. And so I don't have the luxury to wait days to say, oh, by the way, one of our children got hurt or something happened. Because again, we're in the city of Chicago, it should be same day. And so again, you know, I know how hard and stressful it is on your side. But again, I want to make sure that you understand, that I understand, you have policies and procedures within your organization where certain people need to be informed about different things that are happening. What I'm making sure that you understand is that what I need from you is that you don't let a day go by that you have not communicated to DFSS about something that occurred. If it happens on a Friday, it still needs to be in that email box so that we then have that same day. We're going to document the date and time that it came into us so that you can make sure that the things are in there. So for those of you who have partners on the ground, I need you to think about how you're working with them, because they should be reporting to you same day. You're reporting to us same day. Again, I'm going to say it again. Partners should be reporting to you same day. You should be reporting it to us same day. So we've got to have a communication chain that gets everything up and into our mailbox, at least a notification. Again, I'm not saying that you're going to give me a fully loaded written report, but I'm asking for a communication to let me know that something has occurred with a child in the program. Because again, one of the things that is going to help me work with you on is mitigating risk. Is going to help me get in there and help you. I'm going to be there. My team's going to be there. We're going to support you all the way through this, but we can't have our heads wrapped together around this if the reports aren't coming to me. I'm of no help to you if I can't get it. That's what we're here for, is to support you, to make sure that we can help you mitigate risk on the ground. We can start thinking through what we can do to make sure this doesn't occur again, et cetera, et cetera. We need to partner in this. We need to work together, because the goal is for there not to be reoccurrences. I know that we can go in and we can do different things. I know how stressed you are. I know you're down staff, but what we have to do is mitigate risk. We have to minimize, and we have to do everything we can to ensure the safety of every child in our care, regardless of age and regardless of model. And I want to say that regardless of model. We are required to do this. I'm going to go to a question in the chat box. If our Head Start, early Head Start children are in their home and return to our center in a cast or boot, would you like us to report those incidents? Absolutely. Again, one of the things I remind everybody, a lot of times things may happen in the home and the parent, I'm just saying this to all of you, it will happen in the home and then parents will come in, not inform you that something has happened, and then report to a doctor that it happened in your center. And so if you're doing your check in the morning and you find that a child has had an injury or something over the weekend, and you let me know that, I have it documented in my record. And then if something comes of that, then we both have a documented record and I can work with you on that. If I don't know, and then the parent makes a different record out there and all of a sudden it comes to me that something happened to a child, then I don't have a documented record, and it's going to not give me the same flexibility and ability to work with you. And that's what I want to do, want to work with you on that. Again, make sure that if you're getting something that happens and restricting the child in your program, meaning that child's not going to be able to do what they normally do in program, then you need to be reporting that. Yes, PFA, PI as well. I want all of these reported to me. Let me explain another reason and a rationale for this. Office of Head Start is in Health and Human Services in DC. So is licensing in Health and Human Services in DC. And so if something is occurring in your center and licensing knows it and we don't, guess what? Those two agencies talk to each other. And so you may call your licensing rep and talk about something, but you may not inform DFSS. Well, that's not going to stop Office of Head Start from knowing that it occurred, because those two entities are talking to each other to make sure that they know what's going on the ground. And so what I'm trying to do is keep us all on the same page. I can support you. We can work with you. We can help you strategize. We can mitigate risk. We can do all of these things working together. But when we're not getting it, it ties our hands and then takes me off in a different direction on what it is that I'm now responsible to do. Do we report allegations that something occurred, but it did not? But we did not involve DCFS. Yes. Yes, even if it doesn't, because if something else, just because it doesn't get reported to DCFS today, doesn't mean somebody's not going to report it to DCFS. Then it's in our record. If something comes up, we can go back to that record. We can then again say that you gave notification. We were aware of this, ... Let's work together. Let's not miss anything. Let's get it all in there so that we have records in your house, records in my house, and that these are similar reporting. I've got your information. And I know when something comes, if I get a question from Office of Head Start, I can go directly to what I have and I can let them know what it is that I know is going on in your house. I'm trying to go back to the chat box before I go to my next slide. Yes, we do let parents know to let us know as soon as they know. I understand sometimes there's going to be a delay in that, but again, document. Again, in Head Start, if it's not documented, again, it didn't happen. And if it's not documented in your records, it's not documented in mine, then that's the problem that we all enter into, and that's a problem. Do I want incidents on just the child? If there's something going on with parents that needs to be reported, report it to us as well. If a parent is hospitalized, if the child is hospitalized, we want to know why, because we may need to make sure you get some resources or something to help you with that. If you're not reporting it and you need resources, we don't know. Our job is to try to circle around you and give you all the support that you need. And so please let us know. Yes, domestic violence. Yes, please let us know. Because again, I'm here in DFSS. And we have, a division on domestic violence. I can bring in additional resources. But when I don't know that you need those resources. And we want to make sure that we're able to help you. I want incidents with our home visiting parents or just the kids. I want both. I want to know what's going on. People, what I'm saying out here, and I want to remind all of you, we are mandated reporters. We are mandated to report. So I'm not asking you to do anything that you shouldn't be doing. You're mandated to report. You're mandated to report to us as your funder. You're mandated to report to licensing. You're mandated to make sure that you are reporting to DCFS. These are things that are required because of who we are and what we do. None of that changed over COVID. We're doing the same thing. I just want to make sure that what's coming to me is coming to me in the amount of time that allows me to be able to circle my wagons around you and support you, get you additional support, mitigate risk, reduce all of these things from happening so that we can get to a point where we're not talking about it the way that I am today. I want to make sure that you understand if I get something reported to me and it's delayed, it is against Office of Head Start performance standards reporting policy. So now it's a non-compliance. We should be in compliance because we've been talking about this for years. We shouldn't be in non-compliance for reporting. I'm not saying that there's not going to ever be a non-compliance, but this definitely isn't one where we should be in a non-compliant status because we've been saying this, I know since I've been in this chair, requiring it. We've changed it, it's in sales, it says same day. If you get new staff, point to that, make sure that they see it, it's in sales, make sure they understand it, make sure that they don't misunderstand what we mean by same day. Same day is the day that something occurs. It is a notification. It is followed by a report, and then it may be followed by additional information is needed, and it may be followed by an investigation on our part, and it may be an investigation on your part, and DCFS may be investigating as well. All of those things are required. Next slide.
Hi, Saritha, we're having a bit of technical difficulties, so just be a moment, please.
Thank you.
Thank you.
Yeah.
Okay, are you able to see the slides?
I am.
Great, next slide.
There you go.
Thank you.
All right. All right. Thank you. Thank you. See, this is why on today it's cloudy and rainy and everything that is doing out there. I wish I were in front of you. Then we could all be in the same space and I wouldn't be worried so much about the slides, folks, but we're having some technical difficulties and I apologize for that. So I want to be clear. I want to make sure that we have got clarity today because I don't want any more missteps. A phone call to your monitoring team, immediate same day of incident, letting us know, again, notification. That's what I'm asking you for. What they're going to do, they will record the date and time that that information was received. And that information then is recorded. It becomes of our record. It becomes a part of the record if we're having to report to Office of Head Start. It becomes a part of that record. It then shows whether it was on the same day or days after. I don't alter dates. I cannot alter the date once it's given to me. I have to use the documentation as written by you. And so it has to be same day notification. We need you to email when you're sending it out. We need you to CC Elaine Millsell Parker. We need you to make sure, just in case, for example, that person who you're sending that email to is out of the office that day. We want another person on there so that it gets to them as well. So that if one person isn't there, somebody else will be able to get it. And again, the email is going to automatically record the date and time of when it was received to DFSS. Comes into our email box. It's an automatic timestamp. We know exactly when we got the notification. That email becomes a part of the record. Again, you can always call me if you need me. My number is here. Sheree, who is over program operations, who works with the team, who's on the ground coming in and out of your center, who supervises Elaine, who's supervising Nicole and Jacinta, who's supervising all of our SSCs. So going down the list of who is reporting to who, just to make sure that all of these things are reported. I'm going to stop for a second to see if I'm missing anything else in the chat, making sure that I'm not missing any of the questions that I have. So I will, again, put the policy link back out there. I want to make sure that everybody has access to the Chicago Early Learning Standards Manual where these things are in there. And so I have copies here at our office at 1615. We can get more copies out. I will send the policy, that section out again, so that people have it. Again, I'm going to do everything I can, everybody. I just want to do everything I can to make sure that there's clarity today. I remind you, we're recorded today. So you've heard me, I've recorded it. You can play this recording for other people. It's going to go up on the website as all of our recordings do. So if you need somebody else to hear my voice and to walk through these slides for clarity, please use it. Go to the Chicago Early Learning Manual, it's in there. But again, now you've got my voice recorded where you've heard me say this, and you also have these slides. Are there any other questions? Again, I just need us to be clear. I need us to all be on the same page as we move forward. The 2.0 is the most recent version. We are in process now. As soon as we can get through a couple of more things of doing some edits, I will make sure that we have access and we can find out from people. And we will do it through CSD Update to find out who needs additional Chicago Early Learning Standards manuals so that everybody has it in their hands. Know that there's going to be another update. If you've got 2.0, then you got the most recent version, Catherine. We have not updated it. We are in the process of updating it, but the language that I'm speaking about right now is in that document right now. Thank you.
Okay, good morning, everyone. Again, my name is Sheree Johnson, Manager of Program Operations and Quality. Some of you have had the pleasure of meeting with you in my current role, or I may know you from a previous role. But as Saraytho mentioned, I am the Manager over Program Operations and Quality, working alongside with Elaine Millsap-Parker, William Hill, as well as Dee Nichols. So just to reiterate what Saraytho previously mentioned as it relates to enrollment and attendance reporting, our operations team, in particular, our ERC SSCs or support service coordinators, are collecting and verifying both enrollment and attendance for the current week every Friday by 2 p.m. So what that means is that they are contacting your agencies, they are contacting your sites to verify and collect that enrollment and attendance information for that current week. So tomorrow is the 17th. So sometime tomorrow by 2 p.m. or closely or shortly after 2 p.m., our SSCs, which will be Zenobia, Freddie, Daphne, or Eddie, may be contacting you or your staff to collect the enrollment and attendance information for this current week. And we're asking for your cooperation in doing so. As Saraytho mentioned, we are going through a manual checks and balance to compare our data that you're reporting to us in comparison to what we've collected in CARES. We know that some agencies are still working to get their information into CARES. However, we know reporting does not stop. We are mandated to report our numbers to our CPPC as well as CCUO. So we need your cooperation in doing so. Many of you and your staff have been very cooperative, and we also know that there have been some delays in gathering some information for some agencies and for some sites. So this is our rah-rah shish boomba to get everyone on board to get this information into our SSC so that we can continue to do our overall monitoring here internally and to ensure that we are reporting timely to the entities that we need to report to. So this applies across the board to all funding streams. So we know some of you have multiple sources of funding from us. So you may have Head Start, you may have Early Head Start, you may have just one funding source, you may have just PFA, you may just have PI, whichever. We are asking for this total enrollment for each of your funding streams, for each of your agencies or sites. And that is what our SSCs will be collecting from you on a weekly basis every Friday. In the event that we do not get this information in a timely manner, we may escalate the concern, via email, through a phone call. The SSC may escalate it to Cynthia Nicole. And if we can't get a response that way, they may escalate it to Elaine. They can't get it that way, they may escalate it to me. So you may be hearing from any one of us as it relates to this information, but we are asking for your continued cooperation to report this information. As Saraytho mentioned, we are working through our CSD CARE system to further update the system so that we won't have to go through this manual checks and balance, but we're not there yet. So we're asking for, again, your continued cooperation as we gather this information. And again, that information can be collected via the phone, via email. We know at times our staff will be there in your site. That may not be on a Friday, or sometimes it may be a one-off where they may be physically in your site and they may be able to physically gather that information in person. but we are asking for you guys to report and continue to report that information to us every Friday by 2 p.m. When they do contact the agencies. Do we have any questions, comments, or concerns? I'm checking the chat. And I don't see any questions coming through thus far, so I thank you again for your cooperation. We can go ahead to the next presenter. Thank you.
Hi, good morning, everyone. I'm Alejandra Ortiz, and I am the manager overseeing program administrations. And I am sure I have spoken to some of you, and if I have not, you probably have met my entire team over on the budget side. We are pretty much crunching the time. I know that some of you are still working on some of corrections and budgets. These are including the federal grant budget. So if you have not submitted any of your budgets, please, 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 I ask that you submit everything. I know that we've been going back and forth, making some corrections. It is very imperative that you send those corrections on time. If for whatever reason, you need more time, please let us know, because these budgets were actually due back in January. I know that we've been sending some emails requesting any documents that were not turned in. That is also very imperative that you send those. If we're behind, we throw everybody else behind. So please make sure that if you have any questions regarding your budgets, if you don't know how to make sure you allocate some funding, don't hesitate to give us a call. We are here to help you. Like Sheree had said, like Sarito has mentioned, we are a group of team here that we're here to help you and guide you through the entire process. So please, any federal grant budgets, these are early Head Start budgets that you have not turned in, any corrections, any missing documents, please turn those in to Juana, to Anna, to Janie, to Dina. Please make sure to reach out to me if you have any questions regarding any of the corrections or budget updates. And I will turn it over to my colleague, Areli.
Morning, everyone. My name is Areli Julian. I'm the Assistant Director with Program Administration. We have a couple of updates for CPPC. First thing is the next full council meeting will be on February 24th. One thing that's currently in the works is that we will be implementing a text messaging system for participants that are in CPPC. This will send out reminders and registration information with all of the CPPC meetings. Again, this is in the works, so as it continues to develop and it's ready to be implemented, that we will update all of you guys. And then the last thing is the importance for parent participation. Although we really enjoy having staff from delegate agencies come in and participate, it's really important for parents that are part of CPPC to be in these meetings. This is important because this is an opportunity for them to advocate for the quality program that they want to see in their children's education. And it's also a requirement that's part of Head Start. So we would love to see more parent participation. And if you can encourage your parents to continue to do so, that would be great. And that is all for program admin updates.
Good morning, everyone. I'm here to give a little finance update. Looking at our Head Start, we're about 81% expended. Early Head Start, we're at 69%. Early Head Start CCP, 70%. And Early Head Start expansion, 64%. ECBG at 27%. And CCAP, 35%. Finance department updates, HHS of fiscal year 22 for ARP, CRRSA, and CARES budget extensions to 3/31/2023. Finance will extend the budget end date on current budgets. No revisions are needed. December 22 expenses will need to be reported on accrual to your finance contact in order to meet the comptroller's closeout deadlines. Finance team will reach out to obtain December 22 invoice accruals around now, early February. No CARES award notifications are pending distribution. All fiscal year 22 invoices, including 21 COLA for base contracts, should have been submitted for approved budgets. For any budget pending approval, 22 invoice accruals must be reported to your finance contact as soon as possible and no later than the end of February. HHS fiscal year 23, the budget review is in process. December 22 expenses will need to be reported on accrual to your finance contact in order to meet comptroller's closeout deadlines. Once your budget is approved in the system, you will submit the invoice in iSupplier. The finance team has conducted outreach for accruals. Please ensure to report as soon as possible and no later than the end of February. Next slide. Okay, fiscal year 23 childcare invoices should be submitted up through the end of January, period covered. Monthly invoice submission is required. Invoices related to 22 period coverage should be submitted, and the deadline was January 20th of 2023. Please reach out to your finance contact as soon as possible if you have any extenuating circumstances. As it relates to FY23, PIPFA, the invoices should be submitted through January 31st, 2023, period covered. Monthly invoice submission is required. Invoice related to 2022 period covered should be submitted, and the deadline was 1/20/23. Please reach out to your finance contact as soon as possible if you have any extenuating circumstances. It's a link here for iSupplier training and reference materials. If you guys have any issues or want to take a look at that. New site form requirement. There's information related to that on this slide. The finance contacts, if you have Head Start, Early Head Start, CCP expansion, Laverne Coleman, corporate, RTL, Laverne Coleman, childcare is Selena, PI, PFA is Sharon Davis. And if you missed the welcome email at the end of December, please welcome our new accountant, Teresa Terry Lopez. But please continue to reach out to the above team members with any questions, concerns until further notice. And that is the end of the finance update.
Is anyone reporting this section or? So I'll go ahead, and the CARE system, one of the things that you still have available to you are trainings. We're sending out trainings consistently regarding CARES. They're coming out in CSD update. We're also sending out additional email out, letting you know the trainings are available. And so please make sure that your staff are involved and engaged in trainings. We're working on a section of the system, for example, and once we get everything approved through it, then you're going to get a new link and be asked to go through and be trained on the next section that's going to go live. And so it's continuous. We need people to stay on top of it and continue to sign up for and participate in the trainings that we're offering. It's to help you on your side to be able to effectively use the system. But I know it also is one of the things that you'll be using for additional new staff that come on. These trainings will continue to be available into the future as well. And so people can still take them. They're gonna be on demand, meaning that they can go in and take it when they can. It's not gonna be live, but they will be open and available so the staff can continue to get trainings as we move forward with CARES. Next slide. So I know that was a lot of information. Are there any additional questions from anyone? I do see that there's an ask of the link for the meeting to be put in the chat. Once they compress the meeting, then they actually get the link that will be that can be sent out for this particular meeting. But they have to compress this video in order to develop that link. And so the link will be coming out. I'm not able to put it directly in the chat right now, but you will get the link so that you're able to access this after the meeting. You can show it to whomever you need to at your side. You can review it again to make sure that you have the clarity on what we're asking you to do. Are there any questions? I'm looking at chat, trying to see if I'm missing anything. Is there anything from anyone who wants to offer more information? Are there any other questions? I just want to make sure that as we're leaving today, we're leaving with you feeling like you have clarity on the various items that we've talked about today.
Just for clarity for the attendance piece, you want the number of children and the total number of days for all of the children. So it may look like 30 children with 100 or something days. Is that what you're looking for the weekly reporting?
Sheree? Or someone from your
I'm
team?
sorry, Aisha, my computer was going in and out. Can you repeat that one more time?
For the weekly attendance reporting, are you looking for two raw numbers? One, the number of children that are in a program, and two, the total number of the weekly attendance for all of those children. So for an example, if you have 30 children, then you have 30 and then you have 130 days.
Correct.
Thank you.
We are looking for total enrollment and total attendance for that week, yes.
Thanks for your question, Aisha. Thank you, Sheree. And so I do see a question in the chat. I apologize. San, yes, the governor's proposed budget, how is it going to affect PFA, PI, and CCAP? Again, this is in his budget. As we all know, those budgets have to go through for approval. But if there is an increase to ECBG, what has happened or what occurs is a decision is made how the dollars are being affected across the state of Illinois. A decision about what comes to the city of Chicago, and then our being funded by CPS. If there's an increase that is affected, then we would get that, and then we would be working with those dollars to look at an increase coming out to PFA and PI. CCAP, of course, is in there, but the way that the budget was announced and the way he talked about the budget was about preschool for all. And so when we're talking preschool for all, we're looking at 3 and 4 year olds. That's not to say that there won't be an increase in PI, but I just want to make sure that everybody understands that the state budget that comes through to CPS, there's a portion that comes for PFA, and then there's a portion that comes for PI. We get a portion of what CPS gets for PFA. We get all of what CPS gets for PI because they don't operate PI. And so we only know what we get once all of those things happen. And once the state legislator has agreed and everything is written, I's are dotted, T's are crossed, then the legislative budget, once it's intact, then any additional dollars across any funding stream in the state will receive that acknowledgement. For example, we do have an acknowledgement from the previous governmental budget where there was an increase in a PFA PI. And so we're waiting on and I mentioned it before, to get a finalized IGA with CPS. Once we get the finalized IGA with CPS, then that will acknowledge for us what our increase is, and then we'll be acknowledging to all of you on what that increase will look like for you. That's in the current budget, not in what the governor just talked about. But what the governor did say is he wants a free preschool day for all children 3 and 4. Looking at that, it's, he put in quite a few dollars for that. But what does that frame look like? What does it look like when it comes all the way out into the community, meaning leaving the state legislator signed off, I's dotted, T's crossed, then we'll see exactly what happens in this new budget year that's now being discussed. Your question, Cindy, will agencies get to apply for more PFA PI slots once the budget is approved? Again, the new budget approval, I don't know. The current budget approved current budget that we have, again, I'm waiting to get acknowledgement of exactly what those dollars are and how they're going to spend between PFA and PI. And once we get that, we're going to be looking at what we're doing. I will say this, as far as increasing slots, when we're not utilizing all the slots, it's hard for us to say increase slots right now. We will be looking closely at that so that we know exactly what we're doing. Also remember that all of our new slots, for example, if we're doing something different to any new agencies, they have to go out through the RFP. And we're not there with the RFP. Thank you for putting that out there, Catherine, just as in my head. But for RFP 2024, will programs be able to write for doulas or other administrative positions without increasing our slots? We're looking at what that's going to look like. Once we get a little bit further down the line, I'll have more answers for you. I know doula will be in the RFP as doula will be in a support service RFP as it is right now. It's not going to be blended into the RFP 2024, but there will be a doula RFP when we do our support service RFPs. Doula is one of those because that's how it went out. It went out as a support service contract, and it's going to go back out as a support service contract again. Increasing administrative positions, we'll be talking about what that might look like, because remember, there's an administrative line that you cannot go over a percentage. And so I'm not going to say that you're going to be able to do a lot of increasing in that way, because what you can't do is go over what that percentage is that's allowed on your contracts, both for state and federal. There are some limits to that. And so those are the kinds of things that everybody needs to be thinking about internally. What does your admin look like when you start thinking about any other positions that you might want to add to that? But again, more news to come around the current budget. We're still in IGA discussions with CPS on the current increase that came out for this program year. We don't have a signed off IGA for those dollars. And yes, the governor did acknowledge in his budget that he wants to increase dollars for early learning. And when we're saying early learning, when he specifically ties it to PFA PI, and when he actually said it, he said for preschool for all, and it said 3 and 4 year olds. And so again, how those dollars would then transfer over and actually come out of the state down to CPS and then to us will be determined by how everything is agreed upon at the state level. As we know, sometimes the amount that's in the budget, once everything goes through, sometimes the budget line is less than what was planned by the governor once they go through and look at everything. And so know that he's asking for more, which is a great thing for our children, our communities, but it's not set in stone just yet. We did get an approved budget last year, which is a slight increase, and he's asking for more this year as well. Any other questions? I'm looking at chat, trying to see if anybody is unmuting that might have a question that they want to say out loud and not just put it in the chat box. I'm going to wait just a few seconds and give you time to do that. Not seeing anyone unmute, not seeing any new questions in the chat. And I'm not one to hold you here because I know your day is very, very busy and you all have a lot to do out there. Again, I want to thank you for spending time with us today. Again, I know it was a lot of information in a short period of time. Again, as always, these are taped. I apologize in advance for what you're going to get because our technical glitches will show up in the link that you're going to get. But contextualizing it again, making sure that you do have this available to you. If you're going through it and you have more questions, again, I'm available. I want to make sure that we're all on the same page, that we're doing everything that we can. I apologize again that, CARES is not 100% of 100% today. Again, Sheree talked about what we're looking for in the why, because we have to do our checks and balances to make sure that what we're reporting is accurate. I know the staff are also out in community and visiting sites and looking at records, and also so we're doing our checks and balances and trying to make sure that we're keeping up with everything. We're still working on the care system and we'll continue to be doing that with you in mind. Because again, we don't directly operate and we don't do data entry. It's on your side. And so we're trying to build this and work on it so that you will have that system at hand so that you're able to do all of your work. And then we're able to see on our end and get our questions answered without having to have you do these workarounds. But with that said, I want to thank you for participating and doing what has been asked of you. Thanks for sending in the meal counts that we did ask for. I will need those again, because again, the system is not giving me all of the information that I need. Sheree has already talked about attendance and enrollment. And so until we get to the point where we know that we have 100% that we're able to pull from the system, I'm going to continue to work with my staff, to work with you to get the things so that we can do a check and balance on our side so that we are still able to report all of the services that you're providing on, every day out there to our children and families. So again, I thank you. I thank you. I thank you for all that you do. Again, I ask you to be safe, take care of yourself, take care of your family, your personal family. Also take care of that family that you're in charge of out there with the children and families and staff that you work with every day. Can't thank you enough for everything that you do every single day. Stay well, be safe, and we'll talk to you soon. Thanks, everyone.